We are back with another series. Let's revise PYQs. This will benefit you in your upcoming exam. Let's look at the first question from this video. Question 1. The method of autopsy carried out en masse to remove organs from tongue to prostate is. Your options are. And the correct answer is Litule technique. Here's the explanation.
L for Litule, L for we are taking large mass out. Very, very important. L for Litule, we are taking large mass out. Actually, we all know cervical, thoracic, abdominal, pelvic. All organs are connected with each other. So, my dear friend, it is all are connected with each other, and we are maintaining the integrity of these organs. So, in Gons, it is taking one by one block out. Here, all the organs are connected. So, we are maintaining the integrity. It is large mass, cervical plus thoracic plus abdominal plus pelvic. All are integrated with each other, taking out. It is an evisceration. The complete viscera are taken out. It is also a fast method, but we need a meticulous autopsy. We need a meticulous autopsy. Here, the blood supply and vascular supply are intact because all are connected with each other. So, if we want to see a minor damage or minor bleeding, if we want to see the minor damage or minor bleeding, we can go for Litule method. It is a Litule. L for Litule. Here also, your inter-organ relations are maintained. But what is the difference between Gons and Litule? Litule is en masse. It is en masse method. We are taking the whole mass out as an evisceration. En masse. Gon en block, we are taking block out. That's a very, very simple difference. So, if you were to get a question, sir, if you want to ascertain a simple bleeding, which method can be used? That is the Litule method. Evisceration and mass. GB, Gons, en block. V virtuos, V one by one. It's the most common method.
Question 2. A little boy was playing in a garden. Suddenly, he collapsed and was rushed to the hospital. His friend who played with him in the garden informed the doctors that he ate one of the fruits in the garden post, which he seemed to have developed these symptoms. He also had irritability, restlessness, dry hot skin, and was unable to pass urine and stools. Identify the poison and its appropriate antidote. Your options are. And the correct answer is Datura, physostigmine. Here's the explanation.
Now, sir, Datura is purely an anticholinergic plant, and it is also known as 9D poison. What are the 9 Ds, sir? Every D comes in your mind. Every D. First, start with dryness of skin and mouth. Then, dysphagia, difficulty in swallowing. Dilated pupil, my dear friend, it is considered as the earliest symptom or very early symptom that is causing dilated pupil. Drunken gait, dysarthria, slurred speech, dysarthria, my dear friend. Then delirium, and this delirium is specifically, it is a muttering delirium. It is a muttering delirium. There is a slurred speech and slowness of the body. This is known as muttering delirium. Drowsiness, and the last is death. Last is death because of the respiratory muscle involvement. This is causing death. This is known as 9D. Now, sir, if you get a question, it is very, very important word, carphologia. What is carphologia? Sir, it is a kind of hallucination. It is a kind of hallucination. Like you are making imaginary threads. Imaginary threads. Like you are picking thread from the clothes. You are using a needle and putting a thread. So, Dr. Saab, this is known as carphologia. You are picking, you are using a needle, and there is nothing but you are putting this thread in the needle. You are picking something from the clothes and bed sheet. This is known as carphologia. Carphologia. This is a kind of imaginary threads. And Dr. Saab, there is a pill rolling movement. There is a word which is known as pill rolling movement. Pill rolling movement, like a pill is rolling between your finger and thumb. This is known as pill rolling movement. But sir, this question comes in exam. This is carphologia. That is hallucination with imaginary threads, with needle, with clothes, with bed sheet. And if you are picking imaginary threads, this is known as carphologia. And Dr. Sahib, you can get this question also. Blind as a bat, hot as a hair, dry as a bone, red as a beet, and mad as a hen. These are the feature of Datura. These are the feature of Datura. If these questions are given and you've been asked, these are the feature of Datura. Now, sir, corn picker pupil, what is this? This is unilateral or bilateral mydriasis. If like you are working in Datura, like Datura farm, and there is a dust or pollen of Datura dust or Datura pollen goes in your eyes, this will cause unilateral mydriasis. This is known as corn picker pupil. Now, sir, Mydriatic test, sir, now it is not used Mydriatic test. But sir, what is Mydriatic test? If the patient is having suspected poisoning of Datura and we are using the urine of the patient and putting in the eye of the rabbit, that will cause mydriasis. That is called dilation of the pupil because it's an anticholinergic plant. Now, sir, I am coming to the treatment. Treatment of Datura is stomach wash and activated charcoal. It is stomach wash and activated charcoal. This question is my favorite MCQ. Physostigmine. Physostigmine is the antidote of choice for Datura.
Question 3. What is the likely cause of a diseased person having a body temperature of 39 degrees Celsius? Your options are, and the correct answer is septicemia. Here's the explanation.
Now, sir, in some cases, temperature is not decreased, it is increased. Temperature after death, it is increased for 1 to 2 hours. So, it is increase in temperature. This phenomena is known as postmortem caloricity. Postmortem caloricity. Look, sir, what are the causes? Number 1, very, very simple, sir. Septicemia. Number 1, 3S I have written, septicemia. Number 2, sunstroke. And number 3, strychnine. Strychnine poisoning.
Question 4. A farmer was sleeping in the field, and he felt a sting on his leg. He saw something moving away quickly. He then got drowsy and was taken to the hospital. He developed pain around the site and continued to bleed profusely from the wound site. The wound became red with blisters. Which of the following is the most likely cause? Your options are, and the correct answer is viper. Here's the explanation.
Vasculotoxic. Sir, I already told you, V for vasculotoxic, V for viper. Viper toxicity is vasculotoxicity. It causes DIC and local and systemic bleeding. Local and systemic bleeding. And other bleeding, which are very, very common, it is epistaxis, hematemesis, melena, gum bleeding. These are hemoptysis. These are common bleeding which can be seen. And as a complication, it can produce DIC, disseminated intravascular coagulopathy. Disseminated intravascular coagulopathy. This is known as DIC. And my dear friend, this DIC, as a complication, it can lead renal failure. It can lead renal failure. And Dr. Sahab, in the local bite site, there may be pain, swelling with bleeding.
Question 5. Identify the gun that caused the wound and the range of the shot. Your options are, and the correct answer is pistol, near shot. Here's the explanation.
In rifled firearm, very, very important, sir. In rifled firearm, in contact shot, the muzzle impression will be present. In all remaining, muzzle impression would be absent. Now, sir, come to very, very important one. Shape of the wound. Shape of the wound. In contact shot, I told you the 3 shapes. But If it is our bony prominence, it can be cruciate or stellate. If it is our bony prominence, it could be cruciate or stellate. In other, it is circular, circular, circular. In close shot, near shot, and distant shot. Now, burning, blackening, and tattooing. Burning is caused by flame, as I told you. Blackening is caused by smoke, and tattooing is caused by unburnt gunpowder. Okay. Now, sir, in contact shot, it is inside the track. I already told you. Because it is in contact, everything goes inside the track. So, surrounding the entry wound, it would be absent. Okay. Everything goes inside the track. Yes, in close shot, because it is in flame range, all the three effects are seen. All the three effects are seen. So, there will be presence of burning, presence of blackening, and presence of tattooing. Very, very important. So, Dr. Sir, this is close shot is also known as flame range. In flame range, there will be all three. But, sir, inside the range of gunpowder, near range is the range of the gunpowder. As I told you, in gunpowder range, only tattooing present because flame range and smoke disappears before that. So, it will be only and only tattooing in near range. In distant range, all will be absent. Okay, because all will be absent. Abrasion collar and grease collar present. Yes, my dear friend. Present, present, present. I already told you which is more specific, grease collar. Abrasion collar gives idea about angulation. It gives idea about angulation.
Question 6. Identify the type of wound from the image. Your options are. And the correct answer is defense wounds. Here's the explanation.
Defense wounds, sir. Defense wounds are the wounds which are seen during defense. That is defending. If you are defending, there are the wounds which are known as defense wound. Very, very important. When you are defending yourself, these are defense wounds. The first type of defense wound is active. The second type is passive. Active and passive. Active means you are doing defense in this manner, or passive is just like this. So you actively defend, that's active. So most common site of active defense wound is this palmar surface. Palmar area, palmar surface, your palms. So if you have defense wound on the palm, that means it's actively. आप इसको grasp करते हो, sometime you grasp. Sometime you grasp the weapon. Sometime you grasp the weapon. And most common site, this one. This is the first web space. First web space on palmar surface. This one. First web space. This is the common site. You can see these are the active. But what is passive? Passive means you are not grasping, you are not doing anything. You are just protecting yourself. That's a passive. Protection only. And my dear friend, you can protect by two manners. Number one, this area. This area you can do, or you can do in this one. So this is the most common site is this one. This is the area. It's a medial and or ulnar aspect of medial or ulnar aspect of forearm, the most common site, or extensor aspect of forearm, extensor surface of forearm. And my dear friend, what is a medico-legal significance? If these are there, defense wound are there, that is 100% it is a significant finding that it's a case of homicide. Homicidal in nature. So what is the most common site of, if you see, that is an active defense wound, palmar surface, and it is first web space, and there may be other also. And most common site of passive, medial or ulnar surface of the forearm. This one, or extensor aspect of the forearm, or wrist. Extensor aspect of wrist. So this is active and passive. So you can see the passive one, the ulnar and medial aspect of the forearm or margin of the forearm. Importance, it's a case of homicide. But if someone is hitting from back, behind, there is no defense wound. Someone is hitting when you are unconscious, there is no defense wound. Someone hitting when you are sleeping, there is no defense wound. Defense wound is there when you are active or passive, but you are protecting yourself, defending yourself. Very, very potential.
Question 7. What type of consent is obtained when a 45-year-old female patient is informed about the advantages and potential complications of a hysterectomy, and she gives her agreement for the procedure? Your options are. And the correct answer is informed consent. Here's the explanation.
Informed consent. What is informed, sir? If doctor informs everything to the patient, my dear friend, if doctor informs everything to the patient, this is the diagnosis, this is the treatment, this is the procedure, this is known as informed consent. And Dr. Saab, the best informed consent is the best written informed consent. Written informed consent is the best informed consent. भैया ये procedure है, ये surgery है, we are going for this procedure. This is informed consent.
Question 8. What is the cause of death in a case where a deceased individual has a ligature fully encircling the neck at a horizontal level below the thyroid, as observed during post-mortem examination, and no evidence of saliva dribbling? Your options are. And the correct answer is ligature strangulation. Here's the explanation.
Postmortem finding of ligature strangulation, sir, you have to differentiate. Sir, if you see the external finding, sir, in hanging ligature mark could be oblique, could be transverse, but I told you one thing, that it was above the thyroid level. Here, ligature mark are generally on the neck. Generally, these are transverse. And second question, sir, these are complete and transverse, because there is no node, so it is always complete. हमेशा complete ही होगा. But sir, what about the level? What about the level? In hanging, it was above thyroid. देखो transverse तो hanging में ही हो सकता है. It is transverse. But in hanging, mostly 85% I told you it is above thyroid level. It is either at the level of thyroid, or below the level of thyroid. That's a very, very important thing. Either at the level of thyroid or below the level of thyroid. Now, Dr. Periligature injury and hemorrhages are seen. Periligature injuries and hemorrhages means, see, surrounding the ligature mark, there will be multiple bruises, contusion, or hemorrhages. This is known as periligature injuries. And now, asphyxial sign. Listen very, very carefully. I already told you what is asphyxial sign, CPC. Anyone who can revise with me CPC? Cyanosis petechiae congestion. My dear friend, these are more prominent if we compare with hanging. More prominent. Because if you kill someone, the someone resist, you apply more pressure. So there will be asphyxial sign. Cyanosis, peripheral cyanosis petechian congestion will be more prominent if we compare with hanging. Now, face, yes, my dear friend, face would be congested. Petechial hemorrhages will be present on the face. Subconjunctival hemorrhage can be present, and bleeding from the nose and mouth can be possible. Especially bleeding from the nose. Because of the pressure, these whole area, the face is congested, subconjunctival hemorrhage, petechial hemorrhage on the face. These are the finding which is seen. Bleeding from the nose, these are finding can be seen in ligature strangulation. Sign of struggle. Sir, you struggle, there will be some injuries on your body. Because mostly it's homicidal, there will be some injuries on your body. So these are the finding of ligature strangulation.
Question 9. What is the appropriate term to describe a person who sits naked on their balcony, deriving sexual pleasure from observing others looking at them, while overlooking a park? Your options are. And the correct answer is exhibitionism. Here's the explanation.
Exhibitionism. My dear friend, if you are exhibiting or showing, if you are showing off your private parts means you are showing your genitalia, you are showing your other private parts, this is known as exhibitionism. Very, very important, sir. And my dear friend, exhibitionism is punishable under 294 IPC. 294. In Hindi, you can remember 2, 2, 90 ने चार चीजें दिखा दी. 2 ने 4 चीजें दिखा दी. That's a trick you can remember. So exhibitionism is showing or exhibiting your private parts, and it is punishable under 294 IPC, punishment for 3 months. Punishment for 3 months. Very, very important, sir.
Question 10. In relation to the punishment of perjury, which specific section of the IPC addresses this matter? Your options are. And the correct answer is 193. Here's the explanation.
What is the definition of perjury? This is 191 IPC. So you can see perjury is defined under 191 IPC. Now, second, 192 IPC, fabricating the evidence. If you are fabricating the evidence, means changing the evidence. Like there is a book and there is a document, you are changing that line in the document. That is a fabrication. So fabricating the evidence, this is punishable.
Don't forget to like and subscribe if you found the video interesting. See you in the next one.